I'm Bertha Hidalgo, and I am a professor at the University of Alabama at Birmingham in the Riles School of Public Health. And I'm a genetic epidemiologist. And so I'm really interested in patterns of human disease. I am actively trying to learn more about cardiovascular disease and metabolic disease like type 2 diabetes. So I'm collecting data, analyzing data. So I do a lot of math and statistics to try and understand what the numbers mean and how we can interpret those to understand risk for disease. When I was in college, I didn't quite know what specialty I was going to go into, but I did know that I wanted to go to medical school. And then after I graduated from college, I took a 2-year job at the National Institutes of Health, and I loved what I was learning. So I got a master's in public health in epidemiology and biostatistics. And so I fell in love with epidemiology when I started the master's program. And it's a wonderful marriage of statistics, math, biology, and medicine. I don't think that I fully understood the breadth of opportunities that were available to people who loved math like I did. And so if you find yourself in a place where you're really good at something, I would say do some research to explore what opportunities there are for really enhancing your love for the subject. Do informational interviews, talk to people about what careers could encompass the skills that you gain in whatever topic you're really interested in. And learning that earlier on would have really been helpful. And so public health, to me, is an opportunity to make a change. Public health is really about the public, right? It's about understanding and translating what we know in science and medicine so that people can take the information and the evidence and make safer decisions about prevention of disease and so forth for themselves and for their families. I would be a big advocate for pursuing public health if any of those seem to be of interest to you. STEM has so many applications. So most recently, I have been able to use what I've learned in biostatistics and epidemiology to inform people, educate them, and really arm them with the information that they need in order to prevent cardiovascular disease and stroke. You can use STEM to advance a number of missions in life. So I would say the opportunities are really limitless.